There are two types of venomous spiders categorized by arachnologists: neurotoxic venom spiders and necrotic venom spiders. Neurotoxic venom targets the nervous system by overstimulating neurotransmitters located in your body, or producing the chemical substance released at the end of the nerve fiber, causing insects or other small creatures to become paralyzed. Necrotic venom, a less studied subject, targets tissue around the infected area, deteriorating the skin, inflicting infections that cause tissue necrosis. Spider venom has a combination of various active substances separated by molecular weight, peptides, proteins, and enzymes. Those with low molecular weight compounds are made up of salts, carbohydrates, amines, acid, etc. With these compounds, potassium ion channels assist toxic portions of the venom to spread, while amines contribute to most of the pain. Proteins and enzymes that are higher molecular weight components of venom either spread agents from venom or affect the axon and non-neuron transmitting synapses, leading to more lethal effects. A key component is a neurotoxin called latrotoxin. Alpha-latrotoxin binds to and opens neuronal calcium channels, which increase the release of neurotransmitters. This results in non-specific firing of neurons. The venom is mostly made out of peptides containing cytolytic peptides that interact with neurotoxin components that enhance the venom interacting with the human body. The most lethal venomous spiders known are the widow spiders, the Australian funnel web spiders, and the Brazilian wandering spider. One Australian funnel web spider is called the Sydney funnel web spider, as it's located around the area in Sydney. This spider has a protein called atrocotoxin activating sodium channels in the nerves, creating constant firing of the nerves, enhancing high blood pressure, difficulty breathing, and an increased heart rate, leading to very lethal situations. Most cases have been recorded to last about 15 minutes before the venom spreads throughout the body's victim, ending in death.
Unlike what is shown in Spider-Man Into the Spider-Verse, getting bitten by a spider, such as a black widow or Brazilian wandering spider, will not result in those incredible spidey senses that allow one to crawl on buildings, shoot webs, fight crime, and save the world. Spider venoms are biochemically very complex, which is why they so successfully disable their prey upon attack. In fact, injection of neurotoxic spider venom into a human's bloodstream causes blood pressure to skyrocket. Nausea, fever, muscle spasms, chest pain, and respiratory difficulties can also result. In the case of the Brazilian wandering spider, long-lasting and extremely painful erections can result in human males. Fortunately, though, antivenom is often available for many of the most dangerous spider bites. Antivenom is often produced by injecting the spider venom into a large animal like a horse. The horse's immune system produces antibodies against this venom. These antibodies can be purified out of the horse and given to patients. They bind to toxic venom molecules and prevent them from exhibiting their toxic effects. This is accomplished because the presence of a bound antibody on the venom molecule prevents it from binding to its target site. Antibodies against alpha-latrotoxin, for example, prevent them from binding to calcium channels and thereby knock out the venom. Many patients feel relief within 15 minutes of receiving treatment with antivenom.
When Brazilian wandering spider venom enters the human body, the body reacts by dramatically increasing the nitric oxide production, which inhibits the degradation of cGMP by the PDE5 enzyme, which increases the amount of calcium too, and thereby increases blood flow to the smooth muscle cells. This would make it a good potential treatment for those who suffer from erectile dysfunction. Spider venom could be a treatment for stroke patients and people with hypertension because the anticoagulant, antiarrhythmic, antimicrobial properties of venom could in the future be used to design blood thinners. Spider venom also has the potential to become a useful chronic pain treatment. The most effective and particular inhibitors of the ion channels imperative to the receptors of pain are the peptides contained in the spider venom. Spider venom is therefore being explored as a potential therapy to treat chronic pain. The proteins provide an incredible amount of stability to cells because they are resistant to extreme pHs, can withstand a wide range of temperatures, and are resistant to proteases. The stability of these proteins make the venom of spiders stable and resistant to various extreme conditions. This is another huge benefit to using spider venom as a possible treatment for the human body. Although we consider spiders to be frightening pests, their venoms have the potential to provide us with wondrous new therapies for numerous incurable diseases and chronic illnesses.